Hello and welcome today to the NHCC Educational Committee Roundtable Forum on Cannabis 101, where we bring medical professionals together to demystify the health and wellness power of cannabis to break down the Latinx community's long-held cultural taboos and beliefs on cannabis. My name is David Sanchez. I'm a board member of the National Hispanic Cannabis Council and Cresco Labs VP of Product Development. Today, we are here with two other NHCC Board of Directors, Dr. Phil Burns and Dr. Craig Ontel from State of Mind. So to introduce myself a little bit, as mentioned, my name is David Sanchez. I've been in the cannabis industry since 2012, where the industry really emerged out of Colorado. I've since then have grown my passion around cannabis and its great efficacy that people find. And part of me being in the NHCC is to help advocate for the health and wellness of the plant. So today we have two special guests. I'd like to introduce them. First up, we have Dr. Craig Ontel, who trained at NYU Rusk Institute of Rehabilitation. From there, Craig has spent nearly 15 years of private practice in New York City. Craig also served as the director of the Ambulatory Orthopedic Rehabilitation Hospital at NYU Langone. In May of 2021, he left NYU to become the current CEO of State of Mind Cannabis. For our other speaker and guest on today's show, we have Dr. Phil Burns. Dr. Burns has been practicing medicine for over 20 years, completing specialty training in the field of physical medicine and rehabilitation at NYU Langone Health's Rusk Institute of Rehabilitation Medicine. Upon completion of training, he founded and has operated a successful medical practice based on patient-first principle. In private practice, he specializes in orthopedic rehabilitation and prosthetics. Dr. Burns has participated in academic rounds of the neurologic rehabilitation service for many years as an assistant clinical professor at NYU Langone Health. Dr. Burns is driven by his desire to make a meaningful impact in the state opioids crisis. So welcome to today's show, guys.
Thank you very much, David, and thank you for having us. And thank you for that excellent introduction. I am Craig Ontel, much like you mentioned. And I left NYU, where I was director of orthopedic rehab in May of 2021, solely to pursue medical cannabis. And what transpired is, towards the end of my time at NYU, approximately a third of my patients were presenting for an alternative to opioids, to pain pills, to sleeping pills. And over the prior few years, I was incredibly effective at eliminating those other medications and changing them to a cannabis product which made the patient feel better, but did not necessarily get them high. A big pushback that I had while I was a practicing physician full-time was cultural. And a lot of communities, there is a taboo with regards to cannabis. And it was a taboo that, as a physician, I had to break down. Leaving NYU has enabled me to pursue this passion on a full-time basis and impact many more individuals' health needs.
That's awesome, Craig.
Thank you.
All right. And hey, guys, as an introduction, I also wanted to say a few words about the National Hispanic Cannabis Council's mission, which is to educate the U.S. Hispanic community on the health and wellness and economic aspects of cannabis to empower their support and participation in the industry. The NHCC's mission is to further help demystify through educational programs such as this one, and the health and wellness power of cannabis to break down those long-held cultural taboos and beliefs on cannabis. So let's begin the show by talking about Hispanics and cannabis. First off, I'd like to ask you guys, what do you guys think the major misconceptions around cannabis with Latinos are?
I could start with that one. And, you know, if you could see my face, I'm smiling here a little bit because in the office setting, that's a lot of fun, David. It really is. And in the Hispanic and the Latinx community, depending upon the age of the individual, there is a different opinion as to cannabis. And my patient population that I was treating tended to be roughly 50 years and older from the community. And there was a very big pushback against cannabis. And the reason for it was the preconceived notion that cannabis was only to get someone high and did not have any other therapeutic benefits. When I was one-to-one with the patient, I still had a very hard time breaking down these barriers. And it usually took a family. And it took people from different generations in that family to work together to break these cultural taboos and get to our desired result. I can look everyone in the eye who's watching this and tell them that we were incredibly successful in breaking down those taboos, and it was with education. And that's what was really lacking. Was what folks see is someone sitting on a stoop somewhere smoking marijuana. What patients don't see is the entire other medical end and aspect of what goes on there. And by educating patients that we can play with the ratio of THC, which gives you the cognitive effect, and CBD and the many breakdown products underneath it, which help with pain and inflammation, sleep, etc., we can really formulate a product and a treatment regimen that will eliminate someone's pain, anxiety, help with their sleep, but really not affect them cognitively at all. As we continue on this talk today, we're going to hit a couple of these prevalent CBD, CBN, THC terms we're going to talk about, and it'll become quite clear and apparent to everyone how we're able to accomplish this.
Thank you, Craig. Yeah, and you make a good point. Sometimes it does take, multi-generations to really come together and show folks the power of cannabis. Phil,
David, and I'm sorry to interrupt with that, but when we talk about generations, the thing that's really eye-opening is your younger generation here, their hearts are breaking for the older folks who are in pain and suffering. They are. And families brought in family members that were hooked on opioids. Yeah. And that's the path that they were traveling. And I'll never forget, I had a young girl come in, maybe 20, and she came in with her grandmother, and tears were in her eyes. And she said, "Please give us back our grandma. Wow. We don't have her right now." And that was one of the patients that really made me leave practice and pursue cannabis full time. And we spent the time and we educated her and we broke down those barriers and we walked before we ran. And we started her at a very low product of THC. It never affected her head. We got her trust. And we were able to take that trust and work with that trust and make a meaningful impact in that person's life.
Such a powerful story, Craig. Always really excited to hear those kinds of stories. I think to your point, that's really what helps me continue my passion and continue my drive in this industry. Thank you for sharing that.
You're welcome.
Yeah, of course. But definitely wanted to welcome Dr. Phil Burns as well. Thank you for joining us today, Phil. Wanted to also volley that same question over to you. In your experience, what are those major misconceptions that the Latino community has with cannabis?
I think predominantly it's sort of the say no to drugs mentality, where it's wrong and that's just it. So it's opening people's minds to this as a a viable treatment for their ailments. And not only that, a better modality than using, like Craig had mentioned, opioids or other medications that could affect a patient cognitively, right? So our specialty is really based on function, right? So if you're in pain and you can't move and you can't interact and you can't be engaged, that's no good. But if we prescribe a medication that takes you too far the other way or makes you unsafe or a fall risk, then we didn't help you either. So it's really kind of getting into that sort of sweet spot where we've maximized someone's functional level, decreased their pain to a tolerable level where they can interact and engage, is where we help someone.
That's awesome. The power of cannabis is yet to be recognized by the masses. But all right, guys, let's dive into the meat and potatoes of today's conversations, which today's topic is: what are endocannabinoids? How do they work? Why are they different? Why are they important? And thank you guys so much for joining us today to help us demystify some of these concepts. So let's dive right in. Craig, what are endocannabinoids?
So endocannabinoids. I'm having a hard time with that word. Let's back this one up a drop. Can we pause and stop that? Just because I want to say it properly.
Of course.
Thank you.
All right.
Endocannabinoids are naturally produced in our body. Endo meaning endogenous or internal, and cannabinoids are, in essence, cannabinoids. We have them internally, endogenously, or externally, something called a phytocannabinoid, which would come from a plant. At the highest level, what they are and what they do is they regulate homeostasis. So what homeostasis means is keeping everything in balance. For an example, if you're hot and you start to sweat, that's homeostasis. That's the endocannabinoid system kicking in. If you haven't eaten and your stomach starts to growl, once again, that's your endocannabinoid system kicking in to notify you that you need to eat to maintain that homeostasis. So at the highest level, explaining endocannabinoids, they keep us level and functioning properly.
That's awesome. What a great way to simplify that, Craig. Phil, anything to add there on what are endocannabinoids?
Like Craig had mentioned, it's your body's sort of check and balance system, where if something gets too far in one direction, it brings it back to the center, right? So like Craig mentioned, overheating, sweating, cold, chills, hunger, stomach growling. It's your endocannabinoid system that is bringing you back to into balance, into center.
Perfect. And so one thing that I wanted to touch base on is, oftentimes we see a lot of our physiological systems in classroom settings, in kind of a lot of education that we grew up with, systems like the endocrine system, the respiratory system, reproductive system, circulatory system, et cetera. How come we don't see the endocannabinoid system in this type of literature and these types of education?
That's a great question. So answer one is we're really first learning about the endocannabinoid system, where a lot of these other systems have historically been studied for hundreds of years, which they have. We only have a few decades of research here on the endocannabinoid system. The other thing with the endocannabinoid system, and what really makes it special, is endocannabinoids affect every body system. So whether we're talking about respiration, digestion, reproduction, muscle function, circulation, cognitive, every single system is interrelated, and the endocannabinoid system plays a role in it. some of our most difficult medical conditions to treat, for example, an autoimmune problem, which has multiple systems combined. Folks have probably heard of irritable bowel, very difficult for us to treat in medicine because it's not just one system that's not working, it's multiple systems that are out of homeostasis. And it's the endocannabinoid system that tries to maintain that homeostasis. And that's where a lot of the research is headed towards now. So how we view the endocannabinoid system and all of these other interrelated systems is it's a big grab bag, healthcare. And really the endocannabinoids kind of put it all together and make sense.
That's awesome. And to follow up that question, what are some specific differentiators between, like you mentioned, phytocannabinoids and endocannabinoids, right? So
Sure.
you said phytocannabinoids come from the plant?
Yeah, so endocannabinoids, by the word endo means endogenous. So everybody who's watching this produces endocannabinoids to a different degree. Phytocannabinoids come from the plant. There are two main endocannabinoids that we deal with. However, there are well over 100 phytocannabinoids. And I'll just give you an example. Two of the biggest ones we hear of in literature are THC and CBD.
Of course.
So those are phytocannabinoids. Now, I did mention we all make endocannabinoids. So the endocannabinoids in our body work in that homeostasis, but sometimes we need a little bit of extra help. And that's where those phytocannabinoids come into play.
I see. And so am I getting high from these endocannabinoids? Do they have the same toxicity properties as these phytocannabinoids?
No, actually, it's the opposite. And you're not going to get high from the endocannabinoids at all. The endocannabinoids do not have that cognitive effect. If anything, they have more of a calming and a sedating effect as opposed to getting high. What happens when someone smokes the marijuana flower or plant, which is what we're getting at, is they get a rush of a ton of phytocannabinoids. So you just get overloaded, and that's where the high comes from, the elevated THC and a lot of the other beneficial properties. Because remember, we do have over 100 breakdown products underneath this on the phytocannabinoids, and they all do something different. And that's kind of why if your patient or somebody doesn't feel good and their stomach isn't right and they have a headache at the same time and they feel run down and they use or they smoke marijuana or use marijuana, they feel better because they're getting hit with a lot of phytocannabinoids at once.
That's amazing. And so some of the stuff that I was looking up online talked about endocannabinoids producing this runner's high or cyclist high. Can you guys explain that a little bit more?
Dr. Burns, you want to?
Yeah. Well, so one of the endocannabinoids, there's the two main ones that people talk about is one called 2-AG and the other one amantadine. All right. Amantadine is known as the sort of bliss hormone, right? So it produces the runner's high, but both of them are active in managing sort of appetite, pain, and an immune response. And they help with sort of relax, rest, restore.
That's awesome. And can you guys tell me a little bit about how some of the science or like some of the practice is going on today? How are folks targeting the endocannabinoid system? How is research leveraging these endocannabinoids as well as phytocannabinoids to drive efficacy through medicine, therapeutics, etc.? What are you guys seeing in the field?
that's why we're here today, and that's why we left practice, David, because this is such a fascinating field of science for us and for everybody else. You know, but we're really just in the forefront and just in the beginnings of it. And as we become more objective and our data becomes more granular, we will become a lot more specific in treating specific conditions. And I mentioned before, there's really over 100 plus breakdown products we're talking about here. And I'm just going to use one as an example, which a lot of folks have not heard about in the past because it's not your CBD or your THC, but it's actually THCV, another form of THC. But THCV is actually an appetite suppressant, which is not what you think I was going to say with cannabis. And some cannabis-related medical companies that are getting granular here are able to have a higher percentage of THCV in their product, and they even are calling it a open quotes skinny weed close quotes. Another minor breakdown product is CBN.
Okay.
CBN for us is fascinating. CBN has close to no psychoactive effect, but it's incredibly sedating. So for our patients or friends who can't fall asleep at night, instead of them reaching for that sleeping pill, a cannabis product that's high in CBN will work perfectly. Now, for example, 5 milligrams of CBN is the equivalent of 10 milligrams of Valium, which is a lot of Valium. Yeah. However, the cognitive effect of the CBN is minimal. So as we start to do more research and we really isolate what all of these breakdown products are doing, this is the next wave of medicine. It is. The endocannabinoid system and really learning how everything interacts is going to push medicine forward.
That's huge. That's huge. That's awesome. Well, hey guys, I think we've done a pretty good job talking about endocannabinoids, the endocannabinoid system, and how it functions, what it regulates. What about the receptors? How do the receptors tie into the endocannabinoid system? Where are they located in our bodies? And how do they work?
So receptors are like a lock and a key at its most simplest description. And the cannabinoids bind to the lock and allow the key to open it. So there are two main receptors. It's kind of easy to follow them, CB1 and CB2. Okay. CB1 is our central nervous system. What I mean by that, that's the brain and the spinal cord. Okay. So anything coming from the brain or the spinal cord is the central nervous system. CB2 is the peripheral nervous system. That's everything else we can think about, from pain, pleasure, appetite, moving around. That's all peripheral nervous system. So two distinct sets of receptors that cannabinoids bind to, and they have different functions. The receptors affect everything, where they're located in the immune system, the skeletal system, heart, liver, reproductive, skin. Some body parts have both receptors in them. However, as a rule, it's CB1 is brain and spinal cord. CB2 is the peripheral nervous system.
All right. So for another topic that we wanted to discuss is something that has recently come up, and that topic is endocannabinoid deficiency. Dr. Phil Burns, can you help explain this a little bit for us?
Endocannabinoid deficiency is not a disease or illness upon itself, but an umbrella term encompassing multiple conditions with common features. Okay. There is evidence that the endocannabinoid deficiency syndrome exists in such conditions as fibromyalgia, migraine headaches, irritable bowel syndrome. These conditions are typically resistant to treatments because the conditions typically involve more than one system.
That's a great question about endocannabinoid deficiency, and it's not an easy one to answer. So I'm going to give you an example of a condition that a lot of folks have heard of, and it's called fibromyalgia. And it's incredibly difficult for physicians to treat. And the reason for that is because it involves the central nervous system, the peripheral nervous system, the immune system, the digestive system. So it's kind of a big grab bag of unrelated problems. And we really haven't been able to manage it effectively, no matter what specialty in medicine has been trying to mitigate these symptoms. And the reason for it is it is an endocannabinoid deficiency. It's multiple body systems that are out of their homeostasis. And if we're able to return them back to homeostasis, the symptoms that the patient is experiencing will abate.
That's incredible. And I don't know much about the endocannabinoid deficiency. I think that's why I was asking, like, I don't know how we measure that today or how one would know if they were deficient on endocannabinoids, but I could see why it would be important to know if you did have that deficiency because of the umbrella that you're saying that the ECS is really covering.
That's a great question. And it's often clinical. So it's really speaking to the patient or speaking to the individual and listening to their symptoms and taking a look objectively at what's going on and coming to that. We're not running standard blood test or lab test in our medical offices that are looking for the amount of CBD or CBN that one has in their body. So it's more of a clinical diagnosis at this time.
So you're saying there's some assay opportunities there for some budding entrepreneurs?
Absolutely. And that's what the beauty of this is as well. We really are just scratching the surface of the endocannabinoid system in healthcare. And as the research comes on board and as we get more granular in what we're doing, it really is going to allow medicine to branch out. And from an opportunity perspective, there are a ton of opportunities in cannabis right now, and especially from a research point of view.
All right, everyone, thank you for joining us today. That concludes our endocannabinoid cannabis 101 discussion for today. Dr. Craig Ontel and Dr. Phil Burns, thank you so much for joining us today. Very insightful conversation to have with you guys. And for everyone listening, if you guys are looking for more information about endocannabinoids or the NHCC, please log into our website, nhccouncil.org, and check us out, please. Thank you.